Adolescents and young adults with ALL have historically had inferior outcomes compared to compared to younger children. What we have learned is that these adolescents, older children, adolescents, young adults, when treated with pediatric-inspired regimens, have improved outcomes. And this is really a standard approach now for a fit young patient under the age of approximately 40 and 50. One of the features of ALL regimens, whichever regimen that is used, whether it's a US-based regimen or one developed in Europe, they all are similarly really rely on the incorporation of a drug called asparaginase and also heavy use of steroids during their induction and consolidation phases. Asparaginase is a notoriously challenging drug to give. It has a set of unique toxicities. Many of those toxicities accrue at the time of the first couple of doses or during that sort of intensive early phase of treatment, related to metabolic toxicities, thrombosis, hypersensitivity, pancreatitis, and those toxicities have received a lot of attention. But another toxicity that we see in patients who are receiving asparaginase and steroids is that there is an effect and impact on bone health. This toxicity has been relatively underappreciated and underdiscussed because this toxicity happens later in therapy, during the maintenance phase, and even after treatment has completed 2 or 3 years from diagnosis. And often these patients are now back to their lives, they're not seeing their doctors much, the trials have stopped reporting data because everybody's moved on to other things. And so this is something that we really took a look at in our cohort of patients at Dana-Farber who received our Dana-Farber AYA regimen. And we really found that patients, particularly patients who are younger AYAs and patients who received more novel, more recent asparaginase formulations, pegylated formulations, were more likely to have orthopedic toxicity, likely due to the effect of asparaginase and steroids given together, where asparaginase has a pharmacokinetic interaction with dexamethasone, increasing exposure to the steroid. That's likely actually improved the efficacy of these regimens, and we're seeing that those patients have done quite well from a leukemia perspective, but this adverse event that impacts the quality of life in later years certainly deserves more attention and more research in terms of how to mitigate and manage that toxicity.